Okay, go ahead. You're going. This is a video to explain the principles of the Harkins Hypertonic Motion Palpation Assessment System. This is Dr. Murray Galbraith from Temecula, California. He is one of the highly skilled people in this procedure. We're going to go over the points of taut and tender fibers and restriction or movement in the cervical vertebra. We're going to start with the atlas. Well, let's do this first. If someone is carrying head forward, there will often be tension in the neck. So to avoid that, I'm going to have Dr. Murray bend forward, slide his hips all the way back, sit up straight. The point there is to get it so the muscles are relaxed and flaccid in the cervical vertebra. We're going to start with the atlas, and we're going to first go over the transverse processes. I'm going to have Dr. Murray turn his head left and then right. Now, this is a recheck. Before, we found that there was tension on the atlas transverse on the right, which would indicate an AS atlas on the right. Then I palpated the posterior arch on the atlas on both sides, and we found that he also had tension on the right side. Now, that would indicate that he had an ASR-PIR misalignment. Now, from there, we go down and we lay the fingers along the side of the zygapophyseal articulations with slight movement to see if there's motion and if the muscles are relaxed as they should be. Now, when we came over to the right side, we found that he had tension on the lamina pedicle junction, and the spinous on the right side, which would indicate an axis ARS. Now, if it had been on the posterior portion of the lamina pedicle junction where the tenderness was, and the spinous on the left side, that would indicate a PI, a PLI, but we found it on the right. So we adjusted the atlas, we adjusted the axis ARS, and we adjusted the atlas ASR PIR. Now we can feel now that the tension has been relieved over the axis and over the atlas. Now, in some of these complicated cases, we find that the leg checks, Thompson-Deerfield, and the Prill checks will not reveal any imbalance. But then we do this palpation and we find that there is restriction and tension. Making the adjustments to release that create a marked difference in the symptoms and the balance for the patient.